Hi, everyone. Welcome to another exciting episode of Health Talk with Dr. Mo, a show where we make it real, relatable, and rooted in facts. Today, we have a special guest. She is an amazing person. She is well traveled, well known, a good health educator, an empathic doctor to her patients, and she is a consultant internal medicine specialist and also a diabetologist. And today we're going to be talking about something absolutely interesting, something that I know that is going to benefit you. We're going to be talking about hypertension, high blood pressure. So please welcome with me the ever amiable Dr. Khadija. Welcome to the show.
Thank you so much, Dr. Bo. It's such a great pleasure to be here with you.
Thank you.
Thank you so much.
Thank you for honoring our invitation. I'm so delighted and I look forward to this episode.
I am too. Very important topic chosen today.
Yes. So we want to talk about hypertension, high blood pressure. A lot of people know it as high blood pressure. Some know it as hypertension, depending on the level of knowledge.
Yeah.
What exactly is hypertension? And what are some of the common causes or risk factors for hypertension?
Right. So this is a very, very important topic. And as you said, hypertension is just the fancy word that we use in the hospital for high blood pressure.
Yeah.
And, we have set definitions for what a high blood pressure is. So anything above 130 millimeters of mercury over 80 millimeters of mercury is usually considered as, a high blood pressure.
Okay.
So there are a number of factors that could actually put somebody at risk of having high blood pressure.
Okay.
The commonest is, of course, a genetic risk factor. There's some people who are just, born with these genes that make you more prone to have high blood pressure.
Okay.
But the genes themselves are not everything, because then it's our lifestyle that's actually more important. It's the lifestyle that's actually important. So a diet that is composed of a very high salt intake is one of the risk factors. So if people are consuming a lot of processed foods whereby there's a very high salt intake, that could then help somebody who has a genetic risk, make it more manifest.
Okay.
Right? So that's one of them. Obesity is another risk factor.
Okay.
Stress contributes, but we'll talk about that later on.
Yes.
Right? So stress, maybe, if it's too much stress, that might contribute as well to high blood pressure. People with diabetes are also more prone to have high blood pressure.
Okay.
And then there are other sort of factors, such as, if you are somebody who is more prone to have kidney stones, for instance, that can also predispose you to having high blood pressure. But by far the commonest, I think, is the lifestyle, right? So inactivity, consumption of processed foods that are very high in salt, being overweight and, living with obesity and diabetes are some of the commonest causes of, or risk factors that contribute to people having high blood pressure.
Wow.
It turns out to be one of the most common medical problems, conditions that we see in our practice. Unfortunately, not many people take it seriously. Not many people, even when they have a family history, for instance, do their regular checkups, and, seek out from their, physicians, do I have a risk? What can I do about it?
Right.
So, those are the sort of things that, we want people to know, that this is a common condition. It is a treatable condition. And if not treated, then it does have some consequences.
Okay, we'll get back to the
Right?
consequences.
Yeah.
Yes.
Okay.
Thank you so much for that powerful opening. I mean, genetics, of course, obesity, diabetes, and high salt intake. These are some of the factors you've mentioned about. So, how do you diagnose it? How and how often should people who have these risk factors come to the hospital
All right.
to get checked?
Okay, so as soon as you've got any of these risk factors, you should be seeing your physician periodically, at least, once a year. We say you should, have a blood pressure check.
Okay.
If it was elevated, usually we don't, consider the very first reading as if it is elevated, you would want to check that again and verify.
Okay.
But if it is consistently elevated, then, the doctor would make a diagnosis and say your blood pressure is elevated. And they would, first thing, of course, advise on the lifestyle changes. So, the physician will have sort of a rundown of kind of foods that you're eating, and maybe just by making some modifications in your salt intake and in the amount of processed foods that you're taking, that in itself could, help to lower your blood pressure.
Right.
But if it's consistently high, then most people will require to have, medications, and that will, of course, be determined by the physician. They look at your profile, run some tests, and then determine what would be the best, blood pressure medication for you.
Okay.
So the diagnosis is very simple. It's just involves a blood pressure machine at the office, which, the doctor will take while you're resting. You shouldn't be smoking. And, that reminds me, smoking is another risk factor that, puts people at risk for having high blood pressure.
Right.
So in a quiet, sort of office setting, your blood pressure can be checked either by the physician or by any other healthcare provider, such as the nurse in the office. There are times when we might, ask an individual to take the blood pressure monitor with them at home. So this is what we call an ambulatory blood pressure monitoring, just, kind of to verify, because some people have sort of high-ish blood pressure readings when they come to the office, the anxiety of sitting in an office room, and sometimes, so then to kind of do away with that, we send them off with a blood pressure monitor attached to them, and that then takes readings periodically throughout the day, or 24 hours, sometimes 48 hours. And then, we can look at the readings and look at the pattern and at exactly what points in the day that this individual has high blood pressure. Is it in the morning? Is it in the afternoon? Is it in the evening? And so on. And then we can advise and tell them to make their lifestyle changes accordingly. So that's one way. The other way is just, you can have also the commercial blood pressure machines that are sold, in pharmacies. People can also use those, particularly for monitoring their blood pressure once you're on medication. You can use it once or twice a day, just to see if things are okay. So there's home blood pressure monitoring, there's what we call ambulatory, or there's just an office monitoring. So that's how we make a diagnosis. At any point, of course, even when we do recommend that people start on medications, we still make the emphasis on the lifestyle changes. That is so important, because we know that the medications work best when they are coupled with the lifestyle changes. So if the individual is smoking, then not just to cut back, but to stop smoking.
Stop smoking
completely, because, not only is it the risk for hypertension, but for other diseases such as, heart attacks and strokes. So, we would recommend that they stop smoking. And then, of course, make sure that they're very mindful of the amount of salt that they're adding to their food. So it's not to say that we say zero salt,
Salt.
so people shouldn't, mistake that and say no. So we say no added salt.
Okay.
And, I emphasize a lot on the processed foods because these tend to have high amounts of salt in them.
That's true.
So, your potato chips and your sausages and things, all that processed stuff, the baked, these usually tend to be loaded with salt. And so if people can, reduce the amount or avoid them altogether, that would be the best thing.
Oh, nice. Yeah. Wow.
Yeah.
So you mentioned that you ask patients to check their blood pressure in the morning, afternoon, and at night.
Yeah.
Out of curiosity, is there a difference? Does it change the diagnosis if the patient's blood pressure is more in the morning or any of the time zones? Does the time zone give you an idea okay, this patient's...
Yeah, so, the thing when we do want them to do it sort of at home, so sort of the ambulatory one is trying to look at a pattern.
Okay.
So the blood pressure does fluctuate and, it is going to, fluctuate according to your activity levels, your stress levels and, and stuff like that. And that's where then it becomes, useful for us when we have kind of more readings and then we can sort of kind of judge and tell what's going on and make a better judgment on what needs to be done. And so usually I say to most of my patients, I want you to check it in the morning when you get up, because at that point you're definitely relaxed. You've had hopefully a good night rest. And therefore, if it's high in the morning, that means you definitely have high blood pressure, because we tend to think that with enough rest, your blood pressure reading should be within normal.
Yeah.
And the other time I usually ask them is that, while you're winding down and getting ready to go to bed as well, hopefully you're relaxed. That's another point in the day where they should check their blood pressure as well. And it's important because people don't usually have any symptoms of high blood pressure.
That was the next question,
right?
That was the next question.
Yeah, it's what we call, unfortunately, a silent killer, right? By the
Silent killer.
By the time somebody does have symptoms, then it usually means that a catastrophe has happened. It's already too late. So if you're coming in with chest pain, it means, you're probably suffering from a heart attack. So there are no specific symptoms, although some people will tell you, when my blood pressure is high, I have a headache. But a headache could be from anything, right? You could have a headache because of being dehydrated. You could have a headache from not sleeping well and so on. So it's a very non-specific symptom.
Right.
If, however, you are having frequent headaches, then by all means make sure that you get these checked out, because they may be related to a high blood pressure.
Okay.
And so that's important. Some people get nosebleeds when their blood pressure is high. So that's another thing. If that is happening, make sure that you go to a physician and get that checked out. But we ask people to monitor, because it's not often that people will have any sort of specific symptoms, right? You could wake up, your blood pressure is sky high, and you're feeling just as fine as anything. Only at some point in the day to suffer a heart attack or to come in with a stroke, because those are some of the consequences, the common consequences of having untreated or uncontrolled blood pressure.
Wow.
Yeah.
Wow. Thank you so much for that. In fact, you've compressed two questions in one. That's really nice.
Yeah.
So does hypertension happen only when you're stressed or angry? Because, growing up, there's this joke that is always made when people are yelling, they say, don't kill yourself, don't have hypertension. It's become like a normal joke.
That's true.
So
Yeah,
is it
that
true?
is no. So that's a myth. That's a myth, right? In it, you know, we don't like people to be angry and upset. But yes, anger does do things to our systems. It does increase the hormones. It increases what we call our sympathetic drive. So you're producing more adrenaline, and then yes, that can spike up your blood pressure, particularly in people who are, as I said, already predisposed. If you have a genetic risk and all that, and you're constantly sort of irate, that can sort of influence, I would say.
Okay.
But anger by itself is not enough to and it doesn't cause blood pressure. It can make things worse.
Okay.
But by in of itself wouldn't cause high blood pressure.
Okay.
But yes, we do, ask people, if you can do activities that can calm you.
Yes.
That does help, sort of tremendously. So things like meditation, we know is very soothing, and that can calm you. Going for a walk, for instance, that could also, help to calm a person.
Okay.
And that, of course, in the long run may help with the blood pressure readings as well. Yeah.
Great. Thank you. Yeah. So just while you were talking, something came to my mind. I remember when we played in football.
Yep.
USA 94. And I think Nigeria was, I'm not a football fan, but I know that for the first time I watched the World Cup there. Yeah. And some people, out of excitement, they shouted when a goal was scored.
Right.
And quite a lot of people were people that I knew then, at least, maybe 2 or 3.
Yeah.
They slumped and died. Yes.
Okay. Right.
So what does hypertension have to do with cases? Is it related at all? And what is the relationship? Because excitement, what's the place of overexcitement?
Yeah.
In hypertension?
So, as I was saying earlier, overexcitement, either in terms of anger or when you're just sort of extremely sort of excited, as you say, football matches and whatever, sports activities are usually very exciting events. You have people who are passionate about their teams, and of course, nobody wants to lose. And when that is happening, that can affect you in a sort of negative way, because if you are somebody who already had that risk, your blood pressure was high, but you didn't know about it, so you're not taking any sort of medication, and then you have this sudden surge in your blood pressure, that's when you could have these sort of catastrophic events where people can, as you've so rightly mentioned, that during these sporting events, either somebody has a heart attack or they suffer a stroke because there was a sudden surge in their blood pressure.
Okay.
And and we refer to this as a hypertensive emergency or hypertensive urgency kind of thing.
Right.
Yeah. So that might be a trigger, but it's not the only event. It just means that this person probably had high blood pressure for a very long time. They already had a diseased heart. They already had problems in the going on in the brain for a while, and then you just had what we call a tipping point. So there was that trigger that then caused this sort of catastrophic event. And that's why we say it's so important that people make sure that if you do have the risk factors that we talked about earlier, that you are seeing a physician, your family physician, or if you're at work, and you have access to some sort of health care, setup, you should be checking your blood pressure. If you already been diagnosed, you shouldn't ignore the medication. That's very important.
Okay.
And if if you were started on a medication and you're checking your blood pressure is still high, do go back to your physician so that they can make changes, add on things. Some people will need one kind of, medication. Some people will need multiple.
Okay.
It varies really from person
Right.
to person.
Right.
But it's so important that, we take it seriously, because the consequences are usually very catastrophic. They are life-changing. So if you survive a stroke and it leaves you with, paralysis, then you're disabled, right? So you've gone from being a normal person doing your work, and suddenly you're dependent now on other people to do your activities of daily living. And these are the things that we want to avoid. Or if you have a heart attack, for instance, you might survive the heart attack, but then you may then go on to develop heart failure. And that is going to restrict your life in such a great way. And so these are what we say avoidable circumstances.
Right.
If you have high blood pressure, you don't need to end up with a stroke or a heart attack. It can very much be avoided, provided you take your blood pressure tablets regularly. And when I say regularly, that means every single day. Yes, we're human and you can forget, but you don't have lapses of weeks and days where I forgot, or I traveled and I
forgot my medication.
That's the usual thing. Oh, I'm traveling, and and you 2-3 days go by when if you skip one one dose, that might not make a huge difference. But yes, if you consistently do it, then definitely it's going to be detrimental for your health.
Wow.
Yeah.
Wow. So viewers, you've heard it all. Don't take your blood pressure lightly. Check yourself, because the consequences of having high blood pressure is grave and can be very catastrophic, just like Dr. Khadija has mentioned. So, Dr. Khadija, can herbal teas and detox can it cure hypertension?
I knew that was coming, and I'm glad you brought it up, because sometimes actually those herbal teas may actually exacerbate the high blood pressure, not as a cure. Right.
So they can make it worse.
They can make it worse. Right. So there are some ingredients that, are part of these herbal teas that can actually make the blood pressure worse off. Right. So there's some people, they cannot tolerate green tea, for instance. Right. That may spike up their blood pressure. So if you want to use them, then do please ask your physician, right? Is it okay if I take them? And when you take them, it should be complementary to your treatment rather than a replacement of blood pressure medication. Right. So I always tell my my patients, right? Yeah, if you want to have the herbal teas, that's fine. As long as, you are taking your blood pressure tablets as well. If you think that the herbal tea helps you to relax or it gives you a calming and soothing feeling, then, by all means, you can have it. But what I've actually seen is that excessive consumption of these herbal teas may, in fact, do the opposite, right? It then can cause what I mentioned earlier about the sympathetic overdrive. It could cause your heart to beat faster, and then it could make actually the hypertension and the blood pressure much worse.
Wow.
Yeah.
Wow.
Yeah. So that's good. That people need to know that it's not a replacement for your
green tea is not a replacement for your medications, nor detox tea.
Yes.
Dr. Khadija has said that it can make your hypertension worse. So if you want to take any of this, either detox tea or green tea, and you're hypertensive, please consult your doctor. Okay?
Absolutely.
So the next question. I know people that are close to me that are guilty of this, and they would watch it. Is it safe to stop taking your medication once your blood pressure is normal?
Oh, right. Okay. So I get asked this all the time. And I say, well, the blood pressure has normalized because you're on the tablets. And as soon as you stop taking them, that blood pressure is going to shoot back on.
Please, you need to say that to the camera again.
So, it's important that you make sure that you take those blood pressure tablets, because once it's normalized, it is normalized as a result of the medication.
Right.
There may be times when we might modify the treatment, as in, reduce maybe your blood pressure tablets so that you're not going overboard, the other way.
Yeah.
However, please, please, please do not stop taking the blood pressure tablets at your own accord. Do it. If at all it needs to be done, it needs to be done in consultation with your physician.
Okay.
Your physician might want to make some adjustments,
Yes.
right?
Yes.
Particularly if, for instance, you started the treatment, blood pressures come to normal.
Okay.
And now if you're getting up and feeling dizzy, it means that, you're having what we call postural hypotension.
Yeah.
In that case, then your physician has to make adjustments to the dose.
Right.
But please do not stop taking the blood pressure by yourself. That's really, really important. Yeah.
So, can you still get hypertension even if you eat healthy and exercise regularly?
Right. Okay. So again, there are just some people who have a genetic risk, and you may still get, high blood pressure as a result of your genetic risk.
Right.
Or you may have what we call other causes. So hypertension can be sort of broadly divided into what we call primary hypertension. So this is something that, you've got that genetic risk. And then it's exacerbated by these lifestyle factors that we just discussed, smoking, being overweight, diabetes, and, and so on.
Okay.
And then there's what we call secondary hypertension. And secondary hypertension can, of course, occur to, anyone.
Right.
Usually it surfaces at a much younger age group. So if you are somebody who's in your 20s or 30s, it's not usual to have high blood pressure. If you do, then it means that there must be something else that is causing that blood pressure to go up. And it's important, therefore, then you need to see a specialist who can do the necessary tests to try and identify what is it that's causing the blood pressure to be elevated.
Yeah. Okay.
It may be something that's related to your kidneys. So, we have a condition called polycystic kidneys. It's a congenital condition, so it's something that people are born with.
Okay.
And this can actually, cause the blood pressure to be high. It's usually a hereditary condition, so it would run in the family. There may be problems in the heart as well. That may be the cause for the high blood pressure.
Okay.
It may be as a result of having excessive hormones as well. And, those may also cause the blood pressure to go up. So, usually when people present to clinics under the age of 40, and, the blood pressure is high, we usually look for these other causes before we say that, it's just your genetic risk, to make sure that we're not missing something that can actually be treated.
Okay.
And then when that's sorted, they can stop the blood pressure attack. Yeah. So it's only those situations whereby the doctors identified that this is what's causing the high blood pressure. If that's treated, then we can say you don't require to have the blood pressure tablets. Yeah. But those are, I would say, infrequent situations. It's not the common
type of
hypertension that we see in our practice. Yes. Yeah.
Oh, wow. So you've answered one of the questions as well, because I was going to ask that people in their 20s or 30s are they prone to hypertension? And you've mentioned it rightly, that if they have genetic predisposition. However, when they come, other causes of hypertension would also be checked, because some might be due to maybe pituitary tumors, the pheochromocytomas and all that. So you've answered that very well. Thank you. So is it possible to reverse hypertension, or is it a life sentence?
Right. Okay. So that's I guess, so reverse would be if there was a secondary cause and you get rid of, that cause. that would then, of course, reverse your
Reverse it.
hypertension.
Okay.
So what I say a lot of times is that you're controlling it, right? And some people, as I mentioned earlier, are able to control it just by lifestyle factors. So maybe they were, having a whole load of salt in their diet. If they reduce that, and then eat more healthy and are mindful about the exercise and so on, that the blood pressure can come down.
Right.
Most people will require some help. And, that's when the medications sort of come in.
Okay.
And so I don't like to use the word lifelong, but I would say indefinitely.
Indefinitely. So it's not a life sentence. Dr. Khadija says it's indefinitely.
Definitely.
Right. So which is the biggest culprit? Salt, sugar, or stress for hypertension?
Oh, right. Okay. All three of them are pretty important. But
Okay.
I would say the combination of a high salt diet with stress would definitely make control of blood pressure a challenge.
Okay.
Right. So, I always ask my patients who have high blood pressure and are on treatment, I always ask about these hidden sources of salt. So just give me a rundown of what your diet looks like on a daily basis. So tell me what you had for breakfast, tell me what you had for lunch and dinner, and then you can pick out. So a lot of times people don't read the nutritional label on the stuff that they're buying. And if you kind of look at that, you will be able to tell not just the calories, but it also tells you sodium, and the sodium is the salt, right? And you want that to be at a minimum. Also, we don't want you to be adding salt at the table. So whatever is, been added, while it was being prepared, cooked, is usually sufficient.
Okay.
Don't add any more so that you can actually feel the taste, the saltiness in the food.
Okay.
So we talk about control. Reversal only happens if there was an underlying cause that has then been treated, and then you could say, yeah, I've reversed it because that cause has been completely removed.
Okay. All right. You mentioned that reading labels. Yeah, I'm a culprit as well. I don't read labels. What is the recommended salt intake per day?
Right. So we should be consuming. I'm not really quite sure of the actual amount. I have to check that one. But the last time I think is less than 1,500 milligrams for everybody. But we can verify that sort of later on. But what's important is that the food shouldn't, and of course, everybody has different tastes, right?
I was going to say that, yeah.
What might be salty to me may not be too salty for you. But what I say is that you shouldn't add, right? And the processed foods always have excess salt because the salt that's added in there is part of the preservative. Right? So it has to be, or for instance, you have the canned foods. These are processed foods, and they usually come in something called brine. Brine is just salty water, right?
Yeah.
So that's all it is. And so, people who are busy and think, okay, I'm going to get a can of tuna, and, I'm going to use that, and they forget to maybe pour out the water and then use the brine, and then that's a whole lot of salt in there. The other thing is that your taste buds also adapt, right? So if you are used to a high salt intake, you require more salt to taste the salt, as it were. All right?
All right.
But our taste buds are also adaptable in that if you start cutting back, right? Initially, it may be difficult.
Yeah.
You may feel that the food
bland.
Oh, what am I eating? This feels like pork and so on.
Yeah.
But they also adapt. And then you will find yourself that with even just very minimal amounts of salt, you're fine. So it's adaptable. So, it's adaptable both ways. when you start cutting back, and the same thing with sugar, when you
Right.
start cutting back and you don't put any sugar in your beverage, initially you may feel, oh, this
What
doesn't
is
taste
this?
the same. What is this? Yeah. But over time, and usually it just takes a couple of weeks for that to happen.
Okay.
And if somebody does now put sugar in your beverage, you'll be like, what is this now? It's too sweet, right? So taste buds can adapt
Oh, that's
and they can learn.
so you can teach your
You
taste
can
buds
teach your taste buds,
what you want.
what you want, right? And so if you somebody who's have a sweet tooth or a salty tooth, I don't know if that's a word, you can retrain your taste buds
Oh, nice.
to kind of adjust to that.
Wow.
Another trick is, of course, if you were somebody who was very fond of salty stuff, you can replace the salt with more lemony things. So if you spice it with lemon, for instance, that takes away your urge to have the salt.
Oh,
Right?
nice.
So that's another trick that people can
great.
use, just to kind of reduce the salt load in the diet. Yeah.
Wow.
Mhm.
Wow. That was packed.
Yeah.
So, why do people delay treatment or ignore diagnosis?
Yeah, that's a really important. And I think it just boils down to the fact that they don't feel anything, right? You could go around not knowing that you have high blood pressure. Sometimes people get diagnosed when they go for their insurance checkup, like you want to have a health insurance, and that's the time when you find out that your blood pressure is high.
True.
Sometimes we catch people when they come for vaccination. So maybe you are due for your routine vaccine. And,
Wow.
I remember during COVID, lots of people, are coming into the
caught
clinic.
the
And
culprits.
we caught them. Yeah, you have high blood pressure. Sometimes, people will be at a party and, if somebody says, oh, let me just check your blood pressure, and blood pressure is high. So it's sometimes an incidental finding. And that's why people then, don't come up for treatment, because they think it couldn't happen to me. I don't feel anything, right?
Yes.
But unfortunately, having that sort of confidence can be quite detrimental. So if you do have a family member who's already been diagnosed as having high blood pressure, it's important that you yourself, even if you are leading a healthy lifestyle, make sure that once a year, go to your doc, make sure that they check, your blood pressure, and see that everything is really okay. And if you've already been told once and, you've had a repeated check and repeatedly your blood pressure readings are high, then don't ignore that either and say, oh, maybe it's because I'm just stressed now, or maybe because,
in denial hypertensive.
Exactly. So if you no, and if the stress goes away, then my blood pressure is going to get better.
Yeah.
So take that seriously. Take your blood pressure tablets, and then you can do any other sort of de-stressing activities, in order to help blood pressure come down. Yeah.
Wow.
Yeah.
Wow.
Yeah.
So, lastly, what is that one thing you want every patient or everyone to know? One thing that strikes a chord in you that you think these people must know, because this show is about empowering people to take care of their health.
Okay. So I said it and I will say it again. High blood pressure is a silent killer.
Silent killer.
It's a silent killer. And therefore it's important that you have these periodic checks. Make sure you know what your blood pressure is like. And if it is consistently high, then you're getting the necessary treatment.
Okay.
And once you're on treatment, you're also monitoring, to see the effects and, having your sort of checks, because it's not just getting the blood pressure under control, but also making sure that the high blood pressure is not affecting the vital organs, right? It's not causing, harm to the heart. It's not caused harm to the kidneys and so on. So these need to be looked into also periodically.
Wow.
Very, very important.
Wow.
Right?
Thank you so much, Dr. Khadija. It's been an amazing session with you. Honestly, I've learned so much as well. And I'm sure our viewers have learned quite a lot. So everyone, this is where we call it a wrap. thanks to the amiable Dr. Khadija Hafiz, who has shed more light on hypertension. Please like, share, subscribe, and share it with someone. Repost it. These are information that are very vital that can make you healthy. Yes, we all hustle for our needs every day, but remember, only a healthy body can spend the money that you make. Remember, health is wealth. I'm your host again on this show, Health Talk with Dr. Mo. See you in the next episode. Thank you.